Welcome to my channel. This is where we simplify anatomy, and here we also learn anatomy with so much fun. Let's look at how blood flows in the heart. This is the entire configuration of the heart. The heart is divided into the right part and the left part by the septum. This is the septum here that divides the heart into the right part and the left part. The right side of the heart, we have deoxygenated blood, and on the left side of the heart, we have oxygenated blood. The sole aim of the septum is to separate the oxygenated blood from the deoxygenated blood. And this is further subdivided into four, and this is the part by which this is done. On the right side, remember we say we have deoxygenated blood. The right side of the heart is further subdivided into two. So we have an upper region and a lower region, and this is done by the tricuspid valve. This is the tricuspid valve that separates the heart into the upper right atrium and the lower right ventricle. So that is how the right side of the heart is further subdivided into two. And this same configuration is also seen on the left side. On the left side, we already know that we have oxygenated blood, and this is further subdivided into an upper part and also a lower part. And this is done by the tricuspid valve or the mitral valve. So this is the mitral valve that separates the left side of the heart into the upper left atrium and the lower left ventricle. Now we have four chambers. So the heart is divided into four chambers, as we have established. And going back to how blood flows in the heart, we know that on the right side, we said we have deoxygenated blood. So how does this deoxygenated blood enters the heart? The deoxygenated blood is taken into the heart through the vena cava, which is the largest vein in the body. The vena cava is further subdivided into two. We have the superior vena cava. This is the superior vena cava, and we have the inferior vena cava, and this is the inferior vena cava. The superior vena cava receives venous blood from the upper region of the body, while the inferior vena cava receives venous blood from the lower region of the body. The superior and the inferior vena cava will merge to form the vena cava, which we already said is the largest vein in the body. And the vena cava is formed just at the entrance of the right atrium, and the blood is then emptied into the right atrium. So the vena cava is the structure that brings deoxygenated blood into the right side of the heart, and it releases it into the right atrium. From the right atrium, the blood is pushed down through the tricuspid valve into the right ventricle. So we now have the deoxygenated blood in the right ventricle that is ready to be oxygenated. And the only region where this blood will be taken to is the lungs. And the lungs, of course, we know contained oxygen. And the vessel that will be taking the deoxygenated blood from the right ventricle to the lungs is the pulmonary artery. So this is the pulmonary artery. And we know that all arteries carry oxygenated blood except for the pulmonary artery that carries deoxygenated blood. And this is the region where that is established. So we have the pulmonary artery going to supply the lungs with deoxygenated blood that is ready to be oxygenated. And of course, the pulmonary artery will further subdivide into the right pulmonary artery and the left pulmonary artery, because we have two lungs. And pulmo, of course, is lungs, and that is why it is tagged the pulmonary artery, the artery that is taking the deoxygenated blood to the lungs where it will be oxygenated. So the pulmonary artery then takes the deoxygenated blood into the lungs where it will be oxygenated, after which the oxygenated blood, that is the blood that now has oxygen in it, will be taken back into the heart, and it is through the pulmonary vein. We already said that all veins carry deoxygenated blood except the pulmonary vein that carries oxygenated blood, and this is where that is also established. So we have the pulmonary vein taking oxygenated blood from the lungs back into the heart, and where it releases it into in the heart is in the left atrium. And this is the left atrium where oxygenated blood is being released into. From the left atrium, it is pushed down into the left ventricle. In the left ventricle, there's going to be a form of contraction. The contraction is to push the blood that is oxygenated now into the aorta, and this is the aorta. The aorta is the largest artery in the body that helps to supply different organs in the body with oxygen and nutrients. And from the left ventricle, the blood that is oxygenated now, that is ready to feed the different organs of the body with oxygen and nutrients, will be pushed into the aorta. And from the aorta, it goes to supply the different organs in the body. And that is how the blood flows in the heart. Thanks for watching this video. Let's continue to stay glued to this channel.